pigmentation is very common. So a very common thing our teachers used to say, like, once a pigmentation, always a pigmentation patient. Means that doesn't mean you can't get cured. You can get cured, but if once you had a pigmentation, you are always prone to develop pigmentation again. For example, few situations I will explain which are very common, like if you fall ill, you have jaundice, you have dengue, you have typhoid or any other illness, you undergo some surgery, you have heavy blood loss, then you develop nutritional deficiencies. Yes, you can have hyperpigmentation or relapse of your melasma or pigmentation again. So if you stop using sunscreen or start using some OTC brand, like you're under treatment, so till the time you are doing the treatment, you are religious with your sunscreen the way I guided or your dermatologist guided every 3 hourly. But after doing the treatment, you are better, you stop using it, or you start using again the OTC brand, over the counter brands, means all the skin beauty brands, so-called brands which are available in the market, at the general stores or in the malls. So you should not switch over to these OTC brand sunscreens. Stick to your medicated sunscreen so that your pigmentation doesn't come back. Another common factor is if you don't use sunscreen as I explained. I treat my patients and when I ask them on their revisit, are you using sunscreen 3 times? They say no, I am using only once. So that is also not good, because if you are using once, it is as good as nothing. One thing should be very clear, the sunscreen should be liberal. You should use in a good amount and it should be repeated every 3 hourly, if not possible at least morning, afternoon and evening. And it should be repeated even if you are indoors, it is cloudy or rainy. So it should be at all the times. And another common notion in our country is it should be used only in summers. No, it should be used throughout the year, even in the summer, winter, both. So another common factor is these days HEV radiation, which is emitted by all our electric gadgets, our iPads, our phones, our TV screens, our monitors. So we are all prone to radiation and we are all prone to pigmentation. Especially the IT professionals who stay long hours in front of the screens, they are more prone to pigmentation and aging problems. So they must use sunscreen very religiously, at least SPF 50. They should use the screen UV guards in front of their display monitors, and your sunscreen should be very, very religious. So even your cooking gas emits radiation. So it's not true like the housewife doesn't need a sunscreen and the person who is going out, he needs a sunscreen. Actually, everybody needs a sunscreen. So another thing, sunscreen should never be below SPF 50. With the ozone layer depletion and the global warming, we should not use a sunscreen below SPF 50. If you follow all these precautions and my advice, then it is very much possible that you can keep your pigmentation at bay and you can avoid the sun damage and sunspots quite effectively, especially when you are going overseas or you are going near the beach during your vacations. So always try to remember to put your sunscreen very religiously. Carry a good sunscreen prescribed by your dermatologist, which is water resistant and as it is effective against IR also, infrared radiation too. Thank you.